Now, allow me to introduce our next speaker, who is going to introduce our panelists for the next session. Rose Nzioka, who is also the president of the board of the Global Digital Health Network. Rose is a senior digital health leader with over 20 years of experience supporting ministries of health and major donor programs across East Africa, West and Southern Africa. She has held leadership roles with Palladium, Associates, the University of Washington, and Barclays Bank. She currently serves as our board president for the Global Digital Health Network and is also a former co-chair of the Global Digital Health Network with a focus on governance, policy, and strengthening national health systems. Rose, you're welcome.
Good morning, everyone. I'm really delighted to welcome you all back to Nairobi for the second year in a row for GDHF 2025. Karibuni sana. So as we begin the deliberations today, we are going to be looking at, we will do the first plenary that will be having a focus on governance. And perhaps you all can admit that in the last 2 decades, we've made a lot of great digital health outcomes, but there's been a spread, of how implementation has looked like. We have seen very strong policies, we've seen slow policies, we have seen fragmentation of digital solutions that has refused to die. As I was reflecting on this panel, I remembered an experience that I had about 15 years ago when we were doing a routine DQA in one of the health facilities in Kenya. And when we were done with the exercise, a nurse called me to the side and she told me they had just lost a mother that morning. And in reflections at the time, the reason why they lost the mother who had complications was because they needed data that was stored in 3 different systems, managed by 3 partners, and they did not have access to 2 of the systems. And this nurse told me, you people keep coming here to ask us questions all the time about the quality of data. Technology is not the problem. How we govern that technology is the problem, because if we could have accessed that data, we could have been able to save this mother. If we could have had data, information, our medical records on time, we wouldn't have lost that life. So it made me reflect on the importance of governance, of systems. Because when systems are governed well, data can move, and when data moves, patients become seen, and when they are seen, lives are saved. Therefore, this morning, as we move on to the first panel, we'll be reflecting on what has worked, what has stalled, and what are some practices that are promising that can be scaled. Kenya has really improved a lot in terms of digital health, and we'll be hearing a bit more about that. But we'll be looking at, based on the Kenya's case, what are the decisions that have enabled this? What are the accountability frameworks that have ensured that Kenya moves to where it is today? And what are some regional best practices, some global best practices from WHO and other agencies that can help us to frame governance in a way that is going to support us, helping that nurse to be able to see the data about our patients so that she can be able to save that life. So we have a mix of experience among the panelists, and I'll be calling them to the front. Starting with Dr. Ayub Manya. As I call you, please come to the podium. Dr. Manya is a health information systems expert. He's worked in the Ministry of Health for many, many years. He has a PhD in health informatics and medical epidemiology training. He led Kenya's rollout of DHIS2 and other digital solutions, and has supported multiple African countries and regional bodies in M&D and e-health. I tell Dr. Manya all the time that he's a walking encyclopedia of Kenya's journey in digital transformation. Next is Dr. Nancy Njeru. Dr. Nancy, if you're here, please move to the podium. Dr. Nancy is a health system specialist with over 23 years leadership in hospital care, national programs, policy reform, and supply chain. She has played a major role in Kenya's UHC and health financing reforms. She is currently the head of digital health and the head of the Directorate of Digital Health. Welcome. Next is Dr. Joyce Wamishwe. Dr. Joyce is another veteran in the Kenyan digital health space. She's the digital health and informatics lead at the Kenya's Digital Health Agency. She's a fellowship-trained medical doctor, and she's driven major public sector digital scale-ups in HIV care and development of the Digital Health Act and the Kenya's data governance framework. Next, we have Dr. Garrett. We have Dr. Garrett Mell. He's the head of digital health and information systems at WHO, Department of Digital Data, Digital Health Analytics and AI, leading global guidance on digital transformation and standard-based software. He oversees work on smart guidelines and the essential digital specifications and the Global Digital Health Certification Network for trusted, verifiable health credentials. Then we have Steve Wanyee. Steve is a biomedical and health informatics professional. He has 25 years of experience supporting over 20 African ministries of health to develop digital health policies, strategies, and large-scale implementations. He's the founder of IntelliSoft Consulting and also founding Secretary General of Helena. Is a president of Elina, and provides global thought leadership on standard-based digital health and AI for health. So we'll get started on the plenary. Collectively, the panelists have many years of experience in digital health. We'll start with Dr. Joyce Wamishwe. Dr. Joyce, in this room we have many experts that have spent a lot of years designing digital health strategies, implementing them, failing at some of them. So if you could tell us from your experience leading digital health in Kenya, and especially now at the DHA, what governance approaches have you seen as most promising?
Okay. So, good morning, and for those who are visiting Kenya, karibuni. So I'll go straight to the question that you've asked me, Rose, and I'm one of those people who has been designing and implementing and dreaming, and I'm happy to be seeing a lot of the things that we have dreamt with some of the panelists, Steve, Dr. Manya. We are seeing those things that we took a long time dreaming and thinking about coming to fruition in our country. So what made the shift? I think the most important thing was getting the highest political buy-in. And our president is actually the digital health leader, ambassador, encourager. He has made the difference in how we are doing things, because before it's not like we did not know that for systems to speak to each other, we need to have, for example, a unique health identifier. We knew. And we attempted it, even rolling out something similar to that within the HIV program. But then we realized at some point we cannot do it alone. We need to work together with the Ministry of Interior. And they reminded us that It's not actually the health sector's job to identify people, but their job. To get that happening needed some nudging from a very high level. And that's why I'm saying that is what has made the biggest shift. The other thing was clarity in vision. We're very clear about where we are going. I think you've heard our CEO speak. But where does this clarity come from? It's the many years of implementing small-scale pilots, failing along the way, and having very deliberate discussions about what exactly does interoperability mean. When I started all this conversation a few years ago, I used to get confused: interoperability, integration, and I could tell Steve, you guys need to unpack for me these words. But then I realized it was more than the words. We needed to be very clear about the vision, then be very brave and bold to implement that vision. But the third thing was to define and determine a financing model that would work for the country. And realize and accept that digital health transformation is not an expense, but an investment. So for us, we are investing, waiting to see the gains. And that is exactly how we have passed the message across board. So I'll stop at that.
Thank you.
Thank you.
Thank you, Dr. Joyce. I think what we are picking from that is highest level. Leadership is very critical, but also so is defining and unpacking what it means. Going on to you, Steve. Global frameworks emphasize equity and interoperability. How did ELINA ensure that digital health governance did not leave behind underserved populations?
Thank you very much, Rose, and good morning, everyone. Yeah, so my name is Stephen Wanye, as introduced, and I'm the president of HELINA. So really quickly, HELINA is a network organization, and we are in about 20 countries. We basically exist to professionalize health informatics, investing in people, building the capacity, and working with government, people like Joyce, to make sure that government is actually promoting trained, competent informaticians. So I think to go to your question, Rose, one of the things that we do at HELINA is that we support partners and governments to build digital health solutions. And I think to ensure that we don't leave, especially the underserved populations, it means that we have deliberately include them in design of the solutions. So that inclusivity from a design perspective, ensuring that the diverse populations with diverse needs are part of designing the solution, is something we do for any project that we are working on. Internally within HELINA, our policies also promote very, very strongly participation in leadership by different people. Really happy to have been working very closely with talented people like Carol Kamasaka, Fatu and others. So we believe strongly that we have to walk the talk ourselves, ensuring that whether it's from a gender perspective, whether it's from geography, whether it's from disability, that we include every voice in terms of designing the solutions. So that's the first thing we do. Then secondly, it's working very closely with governments, particularly with our member associations. Like I said, we're in 20 countries, where associations represent the population and the professionals in those countries. Most of them are in government and also non-government organizations as well. So working very closely with them, we try to influence development of policies and principles, and also guidelines that ensure that there's that equitable representation in terms of how solutions are thought about, the sovereignty of how those solutions are driven forward. And I think, as Dr. Joyce has mentioned, particularly in terms of how to finance that locally, ensure capacity remains locally as well. So I would say those are the two main ways that we do this. And we're really privileged to be working also quite closely with, I would say, with Garrett at WHO Afro, Africa CDC, colleagues are here as well. And very happy to be influencing those sort of policy level decisions and discussions that will ensure that equitable representation, not just in the final solution and product, but also in the process for developing those as well. Thanks.
Thank you, Steve. I think the takeaway from there is that for these lessons to percolate from countries to regions, it's very important that we have strong regional networks that are sharing these aspects. And I know there are many that are represented here. Jai, I know you represent the regional organization in Southeast Asia. Moving on to the global scale, Garrett. The Global Digital Health Strategy emphasizes interoperability across health domains. What key governance challenges still remain for countries in achieving interoperable systems, and how can they be addressed?
Great. Thank you so much, and it's a pleasure to be on the stage with so many luminaries from Kenya and to hear of the progress and vision that each of them and many of you in the room are also helping to achieve. I just want to maybe note that the Global Strategy on Digital Health is a strategy that was authored by 194 member states of WHO. It is their strategy and their vision for what they'd like to see in their own countries. In the strategy, it recommends a blueprint, an enterprise architecture, a set of open standards, and the ability to use common services that are reusable. The term that's starting to be used is digital public infrastructure that many of you may already be familiar with. Countries defined the strategy, and they knew that interoperability standards would make that possible in each of the countries. They knew that by using interoperability standards, they could get to improve patient care and safety with a comprehensive patient view, the idea of continuity of care regardless of which facility, which provider, which health topic. They knew that they wanted to get to the ability to have efficiency of aggregation of data so that they can ensure that they're able to get programmatic oversight and to plan from that. And also that it starts to build trust in the source of the data, that those are from canonical systems and terminology services that define how the data is structured, etc. I think the challenges, though, that many countries are facing is that while they have the vision and they may have a considerable capacity in the country, the aspects of ensuring that there is a sufficient regulatory frameworks in place, and that those are that there are incentives, carrots and sticks, if you will, that help to drive those who are developing systems to be able to make use of those and to know the specifications that can ensure that they're adequately utilizing those interoperability standards in a consistent way. The fragmentation that countries are still facing from legacy solutions that didn't necessarily utilize interoperability standards and may have been funded for different purposes than the continuity of care or the aspects of linking systems. The aspect of workforce readiness and the need for everyone to be able to understand interoperability, to also be able to link systems is a challenge that many countries are facing. I'm really pleased to hear of the progress that Kenya is making among many other countries, I think, where the capacity and the vision are really coming together in a very productive way. As an organization, aside to help to drive countries' ability to move towards that vision that they have at the country level, we have been working to ensure, of course, that there is guidance to countries that is neutral, but it really guides sort of a stepwise approach to thinking about standards, thinking about governance, thinking about how to get these enterprise architecture and the set of services that are important in place. We've been developing specifications, and we've been trying to ensure that countries have the capacity through training and also being able to establish connectathons so that their technologists in the country can connect the systems that they may already have or upgrade those systems to use interoperability standards. We see the emergence of interoperability labs in regions, the opportunity that those who are developing systems are able to plug in those systems and utilize standards to test those solutions. I think we've seen a huge amount of progress despite the challenges that many of the Carol and other speakers have noted over the last several years. And we're thrilled to be on this panel and to see the exciting progress that's being made. Thank you.
Thank you. And even as you highlight those challenges, challenges around human capacity, regulation and accountability structures, carrot and stick mechanisms to ensure that these regulations are implemented. I'm hearing you say that there are tools available, there are labs available, there's help available and resources from organizations like WHO and others. Maybe if we can spin a bit and talk about stakeholder coordination. Dr. Manya, multi-stakeholder governance, being private sector, government, civil society, is needed because we are all players in this space. How did you structure stakeholder roles, and what governance forums have ensured voices beyond the Ministry of Health are heard to move Kenya to where it is right now in terms of being a front runner in digital health implementation?
Yeah, thank you, Rose, for that good question. I just want to start by saying that Kenya is, as we've just been told, is trying to implement digital health across the health system. Just on the academic side, we all know that digitization is very complex. It involves data, people, hardware, software, procedures, and processes. And actually, if you want to summarize stakeholder engagement, you would actually look at that. Each area I've mentioned, when you talk about hardware, there are so many people involved. Some of them even are eager to bring you the computers and all this. They are all interested. And there are some of the stakeholders will not be happy that you didn't buy there. So that's the complexity. It actually brings in what I normally call a web of stakeholders, of interrelated. And sometimes these stakeholders, in as much as we want to make them move forward, you may actually find yourself going backwards. So for the country, we started by giving the legal framework and policy framework. And we actually used the parliamentary procedure. Some of these are embedded through parliament. And when I talk about parliament, I really mean people who represent the country. So they go back home and talk about what they're going to implement. And we think that is one of the highest stakeholder engagement, using parliamentarians, because we assume they go and talk to their people and they come and present there. So that was one of the greatest stakeholder engagement. The other stakeholder engagement was, just as I had put it, just doing the real mapping, knowing who exists, how are they related to this one, who is going to support us, and who is going to actually destroy us. And how did we actually engage them? The first thing was just having a meeting with them, just talking to them, and also going out what we call public participation, telling them this is what we're planning to do, it will impact you on this, and it is positive for the country. And other than that talking, we also encourage the social media. I think most of the younger people than me, they understand social media more than me. So they actually read. They also give their problems on the social media. For example, you may hear that the system you have said, you have brought is not working, and that you take it positively because it gives you a chance to listen. And the other area that we really wanted the stakeholders was on financing. Who would finance some of these things? And in Kenya, we have got private-public partnership. And actually, as we talk, a major part of the digitization effort is being done through these funding mechanisms, where we have a consortium which is leading the digitization efforts. I would just like to say one or two observations. The first observation is what I would call contradictions. In as much as we've been expecting digital health to improve our health care and in everything, there are actually some stakeholders who are saying it may not be true. There are times actually their services are delayed because the system is down. There are some people who are saying the system is too strict, and so some of the things they used to do cannot be done. And so those are contradictions, quite a number. I would mention many, but I don't want to go into to dwell in that. I just wanted to mention, as we work with stakeholders, what are some of the areas we noted. The other thing I noted about is devolution. Kenya is a devolved country. We have national and sub-national systems. Literally, the sub-county were able to work on their own. But these digitization efforts are actually being spearheaded by the national government. And that means that this digitization is also playing a centralizing effort in an already decentralized government, which brings in pull and push. And for the first time, as I work for the national government, I've started having the old feeling where the subnational regions are coming to beg for things from the national level. We want more computers, so we are almost getting back to where we had started in the national. So these are some of the observations I've also made, that we're getting back to centralization, while the reality would have been devolution. The other observation I make is this is what we call in the academia design reality gap. A lot of work is done, but the people on the ground may not fully be involved. So you find what we intended to implement sometimes falls short. But this is a good procedure, because eventually we get into participation with the people we are working with, designing with the people, and that brings in the stakeholders. We make sure that all the stakeholders, we are using them at that particular time. And the last observation I can make is actually we all know about it, the digital divide. Nairobi is a wonderful city. I'm sure you'll walk around and see how it is. But I think Nairobi is not Kenya. And so the same with networks, and the same with internet, and the same with power. So those are some of the observations. And with all this, they all require the appropriate stakeholders, with the people who give power, people who do internet, and we've been engaging them in one way or another to make sure that we have a unified way of moving forward. But at the end of the day, I said, despite all the contradictions, despite all the things we noticed, we are able to actually change this country because we are moving forward. And that's, I just wanted to say that stakeholder engagement is so important. If you don't play it well, the consequences are not very good. Thank you.
Thank you, Dr. Manya. And I think what you're saying is that it's multi-pronged. There are many approaches that you have to use. It's not one size fits all. There are disparities as well between urban and rural areas, and between access, areas that are able to access or not. And I think what you are saying is that we need to go beyond, when we talk about stakeholder coordination, we need to go beyond checking lists, meeting lists or WhatsApp groups. It doesn't count as governance. Real governance and stakeholder engagement is where views are received and they are effected. Dr. Nancy, you find yourself leading digital Directorate of Digital Health now. How are you measuring governance performance in digital health, and what indicators will you be using? How often will they be reported going forward?
Is this working? Good. Thank you, Rose. Good morning, everyone. Yes, I'm Dr. Nancy Njero, as introduced, new director, health financing, digital health, policy and research standards. I'm glad to join this new space. I'm coming from Directorate of Health Products and Technologies. And it's good because also from that other side, we've been speaking about something we've been joking with Dr. Wamishwe called we've been calling it the tower, the data visibility tower for health products and technologies. Basically the supply chain digitization, and we've been really passionate about it. So coming to this space of digital health now is where everything is being cooked. And so we not only oversee everything, but including the dream we've been having of a visibility tower at the national level for the health supply chain. So I'm really happy to be in this space. It's also important to mention as government that we are all being led by the bottom-up economic transformation agenda, which is the current government priority, and the leading government manifesto. It is very clear what is driving the BITA agenda, particularly when we come to health. We do have strengthening primary health care. It's important to mention. We are also speaking to health financing and also the aspect of health products and technologies, and most importantly is the digital transformation. So at the digital transformation, we've done a lot of work passing the laws. And so when it comes to monitoring this aspect, basically, of course, we start with the aspect of the structures, which are very important, because that is where you get it right in governance and leadership. So some of the indicators we monitor, of course, they are the laws and development of the policies. And there's a time, one of it was the development of the Digital Health Act. And that would just be one of the indicators we are monitoring towards putting governance structures in place. So once we have that, of course, we start looking at its implementation, and of course, we break down what does that implementation entail. So in terms of governance structures, we are very keen on monitoring the documents, policy of documents that are being put in place to support that. You know that we have the regulations that are now in place. Those are some of the documents in the past. There are, of course, aspects of telemedicine, AI policies that we are now looking at putting in place, because for governance, policy documents are very key. Now, today we are in a very important stakeholder forum, and I want to thank the Global Health Data Network for putting this in place, and most importantly, bring it to Nairobi, because stakeholder forums are some of the very key indicators we measure at the governance level. Of course, we are guided by our constitution, which is very clear in terms of collaboration and consultation, and there's no government document that can be put in place without stakeholder participation, including the citizen participation. So we are also guided under the intergovernmental law to be able to engage at very high level with both county governments, because we are a devolved system. So we measure regularly on a quarterly basis intergovernmental forums engagements, very critical for ironing out any challenge in the data system area or any other. And we have also the ICCs, what we call the coordinating committees for purposes of that. So we do measure the dissemination forums. We do look at the number of coordination structures, digital structures that are being put in place. We are in a very important period of implementation. And right now, in every county we are going to, we are putting in place the digital coordination structures. We call them TWGs. They must be in place before the CEO of DHA goes there to start working with them. So we are very keen on these structures that are key for governance. And I think we are doing very well so far in the progress, and I believe that we will be able to succeed. Thank you very much.
Thank you. Thank you, Dr. Nancy. I think you're really underpinning the fact that governance is beyond documents. The documents are critical, the policies are important to develop, but it's measuring them, and it's putting structures in place that will enable us to track them. So Dr. Nancy talked about all these things that need to be done, Dr. Joyce, to ensure that we are tracking towards the things that we've committed ourselves to implement in terms of governance. In your role, in your DHA leadership role, what's one organizational change that you've seen as critical to shift from pilot to national scale? Because a lot of these interventions we've had a lot of pilot programs, not just in Kenya, but in many countries in the region. What has enabled Kenya to move towards national scale?
Okay, so thanks. So the main thing has been the establishment of the agency, the Digital Health Agency. And before we figured out that we needed to establish an agency, we had put things like data governance committee in our document when we were developing the Kenya Data Governance Framework. Then when it came to the Digital Act, we still felt a committee, but we were like, no, at some point we do need an independent body that then drives the agenda, and in came the Digital Health Agency. So we've been running and implementing at the same time. The agency is actually about a year, 1.5 years now. So we celebrated our birthday in May this year. And we've done a lot in that time. So we have our strategic plan. We have developed the human resource instruments, which are core, and put ourselves on the budget map. I mean, so that we can also be getting some resources from Exchequer. So when I look back, at some point we were fearing accepting that we needed an agency, but there are certain things that made us say yes to an agency. Beyond needing an independent body, we needed a body that could hire the best of the best. And that, I don't want to say that in public sector that doesn't happen because we're still a public organization, but we needed, there is some part that our Public Service Commission needs to rethink as we move towards the digital health transformation age, to ensure that we have all the necessary critical cadres that would then see this vision coming to fruition. The other thing is we needed a body that could implement the sustainable model of financing that we have. And for us, that is mainly first passing the message that building is not free. Somebody has to put in the money, but data is also not free. Even if you're getting data, somebody has invested to have that data collected, collated, and analyzed in the manner that it should. So we do have levies that we are going to start soon charging. They're already in our regulations. And we definitely needed a body that would oversee that. Lastly, we needed a body that had some regulatory functions for compliance sake. So we have seen a lot of digital health solutions coming up. Last we checked, we did a survey in 2018. We had about, I don't know, close to 4,000 systems being used in various places in the health sector. So we definitely needed a regulatory function. A regulatory body. We had counties coming to the national level and saying, how do we know that this system is good and this one is not? Every cycle of changing governments, every governor came with his own system. And of course, it interrupted whatever data had been collected by then. So in comes the DHA, and one of our key functions is the regulatory function. So just to name a few. Thank you.
I think it's really key to note the difference that the 1 year and a half that the DHA has existed has made in Kenya in terms of moving from not just regulation but ensuring that the regulation is implemented, ensuring we have a sustainable model. Like Dr. Joyce, you were saying, about sustaining these investments that Kenya is making. Back to you, Garrett, again. You know, as Dr. Joyce has talked about all these positives that Kenya has seen as a result of the implementation of the DHA, we know there are still barriers that many countries face, Kenya included. You know, what barriers still prevent countries, from your perspective, from scaling digital health, and what leadership action would you choose to overcome in the next 12 months if you were to make that choice?
Yeah, that's an excellent question. I think what we're hearing from countries, maybe particularly in this year, is a recognition that they want to get to a point of resilience. They want to have a set of essential digital services that are financed locally and that they're maintained locally. And that goal is an ambitious one. It's an important one. And so what I would encourage and suggest is that governments make use of the leadership that they have to take on a specific program of work, something that will tangibly benefit patients, providers, and really surface the benefits of things like of interoperability. I think and utilizing mechanisms like regulation, incentives, but also the idea that, and I think Kenya has utilized this, defining a specification and then encouraging those who are developing solutions so that they can get onto the information superhighway to use that specification to ensure that they can connect. I would say within the next 12 months, I will make a plea for those in the room. You may be aware that all 194 countries this last year said we would like to have a digital yellow card. Many of you will have entered Kenya and had to show an example of your yellow fever or polio certificate. The yellow fever in a digital form came into effect in September. It's a very tangible, pragmatic, I wouldn't say simple, but it's something that I think within the next 12 months, many countries in the room can leverage the technologists that they already have in country. They can look to see how can they migrate over to a digital approach and be able to see the benefits of that. And those benefits could then, those same approaches, whether it's the underlying technology or the interoperability standards, will serve to also be relevant and valuable for other areas beyond the 12 months. Thanks.
Thank you, Garrett. I think the clarion call is out, on what can be done in the next 12 months. So as we come to wrap up this panel, Steve, we'll take you to the final question to you. AI and advanced analytics are part of many digital health visions. Now we have a lot of talk out about AI and its capability. How is governance being set up to manage the ethical use of AI from your perspective? And what can countries do to ensure that we are working on eliminating or reducing algorithm bias, transparency, and accountability?
Thanks, Ross. Because we're running out of time, I'll say this really quickly. For me, I think there are three things. So the first thing is that we're seeing countries rushing to establish regulations and policies, which is great. I think that's the first place to start. But I think one of the things we are also seeing is that we're also starting to see a lot of conflict in how the policies are drafted and the laws are drafted. So, I think we need to have a better coherent sort of like working together sort of environment. And I'm happy to say that Africa CDC, because we're doing some work with them, is leading in that area. And I would also like to encourage you all, if you're interested in contributing to some of the documents that Africa CDC is developing for the continent, for example, the digital transformation strategy, digital health governance framework and all that, including for AI, please come and talk to me. Also, our colleagues are here from Africa CDC. But I think that's the one thing we need to do. Secondly, Rose, I think it's important for us to implement technical and procedural safeguards, whether you're monitoring algorithmic bias, transparency, ethics, and all that. And then I think thirdly, we're seeing countries starting to define new roles like AI ethics officers, and providing that as a formal role and a cadre in the government, which for us as Helena, that's very encouraging and exciting because, like I said earlier, we really want to professionalize digital health in its entirety and make sure that it's we're getting people who are competent, formally trained, and so we're working closely with the pre-service institutions and in-service for certification as well, and make sure that we have those kinds of people. And lastly, I think as has been said by everyone, without the right leadership, governance is just that. That's really all it is. And personally, I think Garrett mentioned this, I feel very strongly that if we don't elevate digital health and AI, in this case healthy AI, to the highest level possible in a country, we'll keep falling short. I think Joyce has mentioned that in Kenya, the reason why we've been successful is because this is a presidential initiative. We need to provide political value for digital health, and similarly for AI as well. If we don't do that, there are some barriers we'll keep running into that are not technical, they are political. And so we keep talking to ourselves, but we need to talk to the politicians. Thank you.
Thank you. I think that's a clarion call. We have to talk to the politicians. So in half a minute, because we are running out of time, I'll ask each of the panelists to tell us what measurable governance milestone will you commit to achieving or publishing within the next 12 months that can be shared or replicated with the team in the shortest time possible. Steve, and then we'll go to Dr. Jones.
For me, I want to welcome everyone. Like I mentioned, we're working with Africa CDC to revise the Continental Digital Transformation Strategy. It's a governance instrument. Please come see me. We'd like to get your contributions to the document. That will be published early next year. Thank you.
So I'll say two. So the first one, we will definitely be looking forward to the Ministry of Health guiding us through revolutionizing the digital health technical working group. We definitely need a space where innovators can come and present what they have, so that then we determine what is going to scale. Then at the Digital Health Agency, we'll be operationalizing the certification of digital health solutions. That is something now that we have been preparing for the last 1 year, and we now want to get cracking and make it move. Thank you.
With a group of experts, we've been working with ITU, World Bank, and many others to develop a reference architecture on the use of digital public infrastructure and standards for health. Within the next 12 months, we'll be releasing that, and we hope that that will be a testable specifications that countries can then look to be able to test their solutions and to bring those into interoperability labs that they're using at country level. We're committed to that. Thanks.
Yeah, for me, I'm interested in coming up with proper legislative ways of handling AI. I think AI is in everybody's lips, and of course the negative part, they are saying all of us are going to lose jobs. So let's think of something that can be done, that can also allay fears and give direction. Thank you.
Thank you. Dr. Nancy?
Yes, thank you very much. First, I would like to thank you for this meeting, and also before I say some of the commitments, I would like also to request or call for the stakeholders here to really support us. I know the change management in the digital system that you are going through, the digital transformation. There will be challenges here and there, and even when those are there, we will request for positive criticism and support. Because we are going to make it. Now, that said and done, I think it's important, that important question you asked, to first mention that in the next 12 months, we'll be having telemedicine guidelines in place. I think that's one of the documents we are going to publish at the MOH website. The second one is that we are working with the Ministry of ICT. Of course, they are leading this. We just had a workshop, 2 weeks ago at Ransom Blue, and we were speaking about AI policy. As health, I think we are running very fast ahead of the others. And the ICT ministry, and to remind us, that one we are leading. We are going to provide direction. So we are really collaborating with them to ensure that in the next 12 months or less, that at least an AI policy is in place, and so that even Dr. Manya can see his dream come true. The last thing I would like to mention, Rose, is that I've come to a space, this new directorate, where I found that the financing and legal ICC is very active, meeting regularly and having very many subcommittees. I know some of you may be there. And I just want to commit that I will be activating the digital health ICC. That's a very critical structure, governance structure, and so I know that most of you will be there. I think if I'm able to revive that, it will be one of my first, is it your turn to give 100 days RRI? I don't want to call it 100 days, but I can assure you that that is one of the governance structures that I must revive. Thank you very much.
Thank you so much. We've come to the end of the plenary. I think what we are saying and what we are hearing is that governance is beyond beautiful documents. Implementation is the crux of the matter. I think the panelists have shared with us, what has worked, some of the challenges they've encountered, and what can be scaled and what is promising. They have made commitments, and all of them are powerhouses in terms of digital health implementation. Find them along the corridors, have a chat with them. If there's something that piqued your interest, ensure you get more information about it. Thank you so much, panelists, and have yourselves a great day. Thank you. Back to you, Carol.
Can we give them another round of applause, ladies and gentlemen?